Health care is a human right, not a privilege. The American people wants, and we are going to deliver, a Medicare for all single-payer system.
There you've got Senator Bernie Sanders yesterday revealing his new Medicare for All plan. But what's really in it, and would it work for all of us? President of the Foundation for Research on Equal Opportunity, Avik Roy, joins us right now from Tucson, Arizona, to break it down. Avik, good morning to you.
Hey, Steve, how are you?
I'm doing okay. Let's talk about three things that Bernie was talking about yesterday. First of all, he announced it would be a government-run healthcare system that would actually save us money. What do you say about that?
Well, it's, the government already spends in America $1.5 trillion a year subsidizing healthcare. So it's not that we don't have a government-funded system. What Bernie is advocating for is, if you like your plan, tough luck. 180 million people with employer-based insurance, with individually purchased insurance, the 22 million with Medicare Advantage, they're not going to have that coverage anymore. It's going to be replaced by something that Bernie likes that you may not.
Right, exactly. And he said during an interview, I think with CBS yesterday, Blue Cross Blue Shield, they'd wind up just covering like nose jobs and plastic surgery and stuff like that, things that the government-run system would not. Also, Avik, he says that it will improve Medicare coverage. What do you think about that?
Yeah, well, as I just said, so many Americans now are not on single-payer Medicare coverage. They're on private plans through Medicare. It's called Medicare Advantage. 22 million seniors, more than a third, are on Medicare Advantage. Under Bernie's plan, those plans would be abolished. They'd be taken away from you and replaced by something that is actually a lot different from the way Medicare works today.
Well, here's one thing that everybody understands: the amount of money it's going to cost you. It will not cost you a nickel in out-of-pocket expenses.
Yeah, that's actually a complete lie, right? So, okay, you might not have a copay at the doctor's office, but you're going to have major out-of-pocket expenses. They're called taxes. The taxes that you're going to have to pay to fund the Bernie plan are going to go up probably about double. Everyone's taxes will go up by about 11% or 12% as a percentage of your income. Plus, there will be a surtax. The plan would increase federal spending, total federal spending, by 71%. So, yes, you're going to have a lot of out-of-pocket expenses. You're just going to send them to the IRS.
Well, there you go. Now, Avik, here's the thing, though. When people hear it, people who are not as understanding about all the issues as you, they hear, hey, you're going to get free health care. Anything you need is going to be free. That sounds great until, of course, the tax bill comes if you pay taxes. But nonetheless, that's going to be a problem for Republicans because the Democrats are saying we're going to cover everybody, not going to cost you a dime.
That's a great point, Steve. So this is the thing that Republicans should do. Republicans should not simply just say Medicare for all or single-payer health care or government-run health care is bad. They've got to tackle the problems that Americans actually care about, which are the high cost of health care. There are a lot of things you can do to reduce the high cost of health care. A congressman in Arkansas named Bruce Westerman has recently introduced a bill called the Fair Care Act that would tackle the high cost of hospital care, the high cost of prescription drugs, but do so that in a way that keeps your plan, doesn't take it away from you.
Well, let's see what happens, because Bernie's just rolled out the latest Medicare for All program, and now people are starting to look at it. Avik Roy, thank you very much for joining us live today from Arizona.
Thanks, Steve.